a regulatory update from Idph, and Sheila Baker from the OHCR will help us. And are you here? All right, again, everybody welcome Sheila. Thank you very much, Sheila, for doing that.
Morning, everyone. Can you hear me okay? I'd like to take the opportunity to thank you for having me here. I am the Deputy Director of the Office of Healthcare Regulation, formerly the Bureau Chief for long-term care. My regulatory focus is going to be more long-term care. Now, the Office of Healthcare Regulation, it has oversight and survey and regulatory enforcement. That's what I thought.
Except to cuss, yeah, except to move the chair most, yeah.
Can you hear me now? Okay, let's back up. And I am with the Office of Healthcare Regulation, and we are responsible for the survey and enforcement activities of healthcare facilities, hospitals, ambulatory surgical centers, long-term care facilities, and many, many other things in regards to the state of Illinois and public health requirements. In that, we also are the branch of healthcare regulation that takes all complaints in regards to things that occur in any of the facilities. We take complaints, we survey, we issue citations, fines, and penalties if there are problems in those facilities. We also work very closely with our infection control branch, the Hacktone Institute. We did a lot of work with COVID, doing focused infection control surveys in the facilities, and also assisting the facilities with improving their infection control by answering questions and working with our infection control partners in Idph. So, although we do all the healthcare facilities, the largest branch of the Office of Healthcare Regulation is the Bureau of Long-Term Care. It's about 75% of the department. So I'm gonna give you an update on what's going on in long-term care, some of the things that have changed, that we've implemented, and we're moving forward. And then I'll also give you a regulatory update as to some of the rules and regulations that have changed moving forward. So first, let's talk about the top cited deficiencies. We have a long arm, a long branch of what we can do in regards to helping improve the healthcare in the state of Illinois. One of the things that we try to do is to look at data and trend it to determine where we're seeing concerns and issues at. And in that, then we can try and focus our surveys even more specifically on those issues. So let's talk about some of the things that are going on in long-term care in 2022. The top rated deficiencies, or the top cited deficiencies that we have and has been for quite some time, is issues with accidents, hazards, supervision, and devices. And essentially what that focus is are falls, equipment, lifts, wheelchairs, bed rails, bathroom accidents. That's what we get the most calls and the most issues about. Number two is infection control and prevention. This not only increased with COVID, it was an issue prior to COVID. And I think that one of the regulations that were updated was to require infection preventionists in the long-term care facilities to try and help focus and work with those residents that may have infection control, infection issues, and to really get the facilities to focus on improving their issues with infection. They also are required to have the antimicrobial stewardship within their facilities as well. They're also required to work within their QAPI areas to focus on infection control and prevention. ADL care is a serious problem, and that includes things such as answering call lights, as well as attending to the residents' needs and requirements for just basic items, including bathing and care, helping and assisting with eating and things of that nature. The fourth thing, of course, is pressure ulcers. Preventing pressure ulcers and healing pressure ulcers. Unfortunately, they do occur. Long-term care facilities also receive residents with pressure ulcers, and just making sure that the facilities know how to care for them, make sure they're getting the correct orders, using the correct treatments. But we do cite quite a bit and have been for many years. Quality of care. Do they have the appropriate staffing there? Do they have the appropriate level of staffing, enough CNAs, enough attention to the care issues that they have? Bowel and bladder incontinence, catheter issues, and UTI. Food procurement and storage, labels of drugs and storage and biologicals, pharmaceuticals, pharmacy services, procedures, and pharmacist records. And rounding out the top for the long-term care facilities is freedom from abuse and neglect. So when you look at this list, it's a long list that we try and focus on. We look at this data every year and trend it to determine what's going up and what's going down. And it's remained pretty steady even throughout COVID. You would have expected that infection control would go up a little bit higher, but it's remained pretty steady. So I think that now that we're on the opposite side of COVID, and with all of your good work, I'm hoping that we start to see a decrease in that infection prevention and control issue on the long-term care side. We also have responsibility for assisted living. We have about 600 assisted living facilities in the state of Illinois. It has grown from probably 120 years ago to the 600 that we have, and it's still expanding. Of course, assisted living is like the skilled facilities of 10 years ago. So they have higher acuity, and they have some of the same issues that long-term care has, with the exception of the staffing and the attention and the acuity of the residents that they serve. Some of the things that are a problem that we cite in assisted living include resident rights issues, which also includes things like abuse and neglect, and other things where the residents are not getting their responses from the administration, and other types of things, just the right to privacy and the right to have a safe space. That's our biggest issue. Service plans, which are basically care plans in the assisted living industry that are not keeping up with the actual care and concern of the resident. The resident may go out to the hospital, come back, and the service plan's not updated. And that is definitely a problem if we're not keeping up with the required care that the residents need. Personnel requirements, qualification, and training. One of the things that we find in assisted living is that because they are sometimes short-staffed, when they have staff come in, they do not get to the training that's required. They will have people that will be working there for several months before they get the basic orientation, before they get training on Alzheimer's or dementia, and that's very important. Abuse, neglect, and financial exploitation rounds up the list. Medication administration is a huge issue in assisted living. There are certain areas in medication that are very specific in assisted living. There's an expectation of self-medication, and then we have healthcare provided medication, but we have this middle ground in assisted living in which we have assistance with self-medication, in which there may be an opportunity for a non-licensed healthcare giver to assist, but there may be a problem with what assistance means in the realm of assisted living. Assistance means that they can still take their own medication. We're just providing information. However, there's a real gray area with that. And that's one of the things that we're going to be focusing on in the next year, making sure that the medication administration within assisted living is up to standard. We also have infection control concerns in assisted living, residency requirements, and that's the acuity. The assisted living was born out of the idea of aging in place. With aging in place, we have residents who go into assisted living, but they may get sicker and sicker, don't necessarily want to leave their home. But under the residency requirements, there are strict requirements on acuity as to when the assisted living is appropriate. I think facilities find it difficult to move residents along to a skilled or another form of care. So we have a lot of people in assisted living with needs for lifts, for caregivers daily, and it really is more than the assisted living facility can handle. Alzheimer and dementia programs being administered correctly, resident records being kept appropriately, and issues with food service. Two of our other types of long-term care facilities are special mental health facilities, which are, we have 22 here in the state of Illinois, mostly focused in the Cook County area, and developmental disabilities, which are located throughout the state. In the SMRF, the focus is definitely more on transition, recovery, and moving back into the community. And they are not as focused on nursing and healthcare and medication, et cetera, which is why number one is health and nursing services. They have a lot of behavioral health assistance within the facilities. They do a lot of job support and transitioning and training. However, their nursing services sometimes are not at the top of where they should be. Recovery and rehabilitation support centers, as I told you, that is their focus. But we also had a lot of issues with that in 2022 because of COVID, the inability of the residents to get out and about or to even have training available in the centers. Keeping up with their policies and procedures, individualized treatment plans, and incidents and accidents and emergency care, and making sure that they're handled appropriately. In DD facilities, governing body issues, policy and budget, and direction over the facility, coordination and monitoring of active treatment, client protections, residents' rights, and measurable care and progress criteria. So just want to go through a few of the updates that we have had in the past year. The federal updates, of course, the expiration of COVID emergency, which is a great, it's a great thing. I think that it felt like we were in COVID for a very, very long time and that we were never going to come out. I think that we have come out of the COVID public health emergency not only much smarter, but more focused on infection control, more focused on caring for our patients and our residents, such that if we ever come upon this again in our lifetime, this type of pandemic, I think that we will be much more prepared to handle it and much more prepared to move forward. So even if we have minor hiccups, I think that we are just a knowledgeable group and we are going to be able to do it better, more effectively, more efficiently. So I want to thank all of you because it was a difficult time. And just the fact that we're back here in person when it didn't seem like we were ever going to get there. It's just wonderful. So thank all of you. Some of the things that have changed, resident grouping, roommate grouping for the disease, that's no longer required. There were waivers for the nurse aid training program, and that's no longer available. I think some facilities may still have a waiver, but they would be individual waivers with CMS. Education requirements for staff and for COVID vaccines, that is still in effect until next year. COVID testing is to follow the CDC guidelines. Idph is still doing focused infection controls surveys for the rest of 23. And there were the modifications that occurred in the adult training programs and active treatment are no longer in effect. Some of the things that we have had rule updates for Illinois Acts and Administrative Rules, include our civil money penalty reinvestment program. That is the monies that we collect for fines and penalties in conjunction with CMS. It has been something that we were developing programs for in order for facilities or providers or programs to request grant money of that money. And we had developed a program for 2022. However, unfortunately, CMS has put a hold on the CMP penalty reinvestment program. Hopefully it will be off soon because there's money available for grants. It will be. So keep your eye on that. It should be on our website once all of the issues have been resolved with CMS. We passed electronic monitoring requirements in long-term care facilities. We also have passed requirements for monthly census reporting for our Colbert-Williams consent decree. That affects mostly Cook County facilities. The Public Act for Isolation and Legionella amendment was adopted for long-term care and ICF, IAD shelter care in veterans homes. The COVID emergency rule expired 5/11. However, we're still looking at some of those rules to be in the process of permanency. One of the largest things we've been working on is our direct care staffing requirements. This was put in place a couple of years ago. We were supposed to be in the implementation period and have moved over to the actual staffing period. However, the implementation period was extended for 2 more years through December 2024. So currently what we're doing is we do collect census information from the facilities, as well as payroll-based journal information from CMS to determine the daily staffing at each facility. And in doing that, we're hoping to be able to let the facility know or keep an eye on the actual daily staffing to determine whether or not the facilities are in compliance with the requirements of the amount of nursing staff, RN, and other that are in the facilities. And if those staffing requirements are not complied with, then they will be fined. Right now, because there is a pause on the fine and penalty period, we are still doing the direct care staffing violations. However, we are just noticing each facility of the concerns and the issues that we have until December 2024, and then there will probably be actual fines. Okay, that's just a few of the things that's going on at IDPH, and I'd be happy to take any questions if you have it.